Hi Annie, how are you doing?
Breathing is still a bit hard, like when I'm laying flat like now.
Okay, let me try to. Does that feel better? How's
Much
that?
better.
You're being discharged.
Finally!
Yeah, you're
So
showing
good, thank you.
significant signs of improvement, especially with your antibiotics. They're working. I would encourage you to keep taking them.
So with the antibiotics, she takes those every day, correct?
As prescribed until you're finished with them.
And then what about the fluids? Like
Fluids.
how much should she be drinking?
At least 8
Drinking
cups
water.
a day. And then I would stay up to date with your vaccines, you know, that way promoting that health wellness. I have a colleague that's going to come in. I know you've been practicing the incentive spirometer. But she's going to come in, just making sure that you're comfortable with it, both of you, in case you know, just to encourage that lung pattern.
Yeah, she doesn't like doing it, so I'll have to get her to do it more often.
Well, I'm going to head out, and then she's going to come in and practice with you guys.
Thank you.
Okay.
Hi Annie, how are you today?
I'm going home.
That's good news. So you're used to this, right? So remember, just you're gonna keep this little yellow piece up here in between these markers, and you're gonna inhale and hold it at this line for like 6 seconds. Yeah, exhale slowly, and then make sure your mouth is, you know, tightly around this. Continue 10 times an hour just for your benefit. Until you start seeing a difference. I mean, you know, it's a deep breathing treatment, so it's going to help you open up. So, do you have any questions?
So 10 times a day,
10 times every hour.
every
is
hour.
fine.
Oh, okay. So 10 times an hour, Mom. You got that?
Well, I sleep more than I'm awake, so.
Well, I'll make sure she does it. I got you.
Okay.
Pneumonia is a pathogen that spreads through the air by people not covering their mouth when they cough or sneeze. Anyone is at risk to get pneumonia, but more people are at risk if they have certain health conditions or if they're over 65. 1 out of 20 people 65 or older die from pneumonia. Pneumonia can be prevented with different vaccines, one of which is the flu vaccine. Pneumonia starts as a secondary infection. The flu is a primary infection. Once people's immune systems are down from the flu, pneumonia can develop. So by getting a flu vaccine, it prevents pneumonia from developing. Also, there are 2 different types of pneumonia vaccines. One that protects against 13 different types of pneumonia and one that protects against 23 different types of pneumonia. If pneumonia is suspected in patients with bacterial pneumonia, one of the signs and symptoms that tells is yellow or green sputum. So as a nurse, you would want to get a sputum sample of the patient's sputum to see and test if they have pneumonia. Other signs and symptoms would be shortness of breath, fever, headache, cough, and the chills.
Nurses, it is important to be aware of the signs and symptoms, treatment, prevention, and education about pneumonia. Well, what is pneumonia? Pneumonia is an infection of the lungs, either by a bacteria, a fungus, a virus, but in this video we talk about bacterial pneumonia. What does it do? Well, it causes inflammation in the lungs and leads to fluid buildup, and this can cause difficulty breathing, and it can lead to respiratory failure and sepsis. In fact, pneumonia is the leading cause of sepsis in patients, and it leads to about half of all sepsis deaths. So, who's at risk? Anyone who is immunocompromised is at risk. Anyone who's above the age of 65, who has a concurrent infection, who has something like COPD, things like that. And what do you do about it? Well, as nurses, we can do several things. We can collect samples to send it to labs, like sputum samples. We can suction secretions to make sure that they can breathe easier. We can give them their prescribed antibiotics to start treating that infection. And we can elevate the head of the bed to make them be able to expand their lungs more.